So earlier, one of the questions that to Cecile and Kelly was, who can you go to when to advocate for more resources? And they of course named all the right people, including themselves. But in New York, we also have a really fantastic Assemblywoman, Linda Rosenthal, and she's been such a great advocate on homelessness and domestic violence. And she couldn't be here today because she's advocating for for us in Albany today. So she did send us a video, and we will watch that now.
Good morning, everyone. I'm Assemblymember Linda B. Rosenthal, and I represent the 67th Assembly District, which includes the Upper West Side and parts of Hell's Kitchen in Manhattan. I also proudly serve as chair of the Assembly Committee on Social Services. I wish I were there with all of you in person, but I am here in Albany as we continue negotiations on this year's state budget. I want to thank New Destiny Housing for inviting me to participate in today's symposium on the intersectionality of racial and gender inequality, family homelessness, and domestic violence. These are issues I care deeply about and have worked to address throughout my time in Albany. The need for the expansion of services in those areas has become increasingly clear. With the pandemic came a devastating surge in domestic violence incidents. As you may know, many survivors have increasingly begun seeking out non-residential services instead of a traditional shelter stay, but state funding has failed to keep up with these needs. On just one single day in 2019, 5,809 victims sought domestic violence services in New York State. An alarming 800 of those requests could not be completed due to funding cuts and staffing shortages at local DV agencies. These providers are doing tremendous work with such small resources. In order for them to keep up with demand, they need additional funding. Last year, I fought for an increase for non-residential services and was proud to obtain an increase of $200,000, bumping the total allocation to $3.2 million. This year, we're demanding $6 million total as the demand for domestic violence services in New York continues to rise. In my role as chair of the Committee on Social Services, I've also been eager to get to work on addressing the growing homelessness crisis, increasing the number of units of supportive housing around the state, fighting food insecurity, and much more. The COVID-19 pandemic has exacerbated many of these problems as well. So I was proud to have worked with New Destiny Housing last year to pass the law raising the FEPS voucher amount to 100% of fair market rent. The FEPS voucher acts as a lifeline for thousands of vulnerable New Yorkers facing eviction, especially for survivors of domestic violence. Before my legislation was passed, the voucher amount only covered 85% of fair market rent. And as you know, for years, housing costs have been increasing, and the thousands of families who enroll in the FEPS program have found it increasingly difficult to find an apartment that fits within the small voucher amount made available to them. At the time of the bill's passage, there was not a single neighborhood in New York City where the median rent for a two-bedroom apartment would be affordable to a family utilizing the voucher. The work of New Destiny Housing and so many organizations enabled us to quickly pass this bill at the close of session last year and see it signed into law this past fall. Because of our work together, approximately 2,300 more families have now become able to find housing using a FEPS voucher. But our work cannot end there. We must also protect New Yorkers who are homeless or at risk of losing their homes by passing the Homeless Access Voucher Program this session. With a seemingly insurmountable Section 8 backlog, it's imperative that we pass this bill this year. This new voucher would function in a similar way to the federal Section 8 program and provide a rental subsidy at fair market value for New Yorkers experiencing or at risk of homelessness, covering a minimum of 70% of rental costs. Critics may cite the program's price tag, as they do with almost all housing initiatives that require funding. But the reality of the situation is that while keeping people housed costs money, it does not cost nearly as much as it costs to provide homeless services. We also know that HAVP is supported by activists, policymakers, and the real estate lobby alike, something you rarely see in New York State politics. Passing this into law this session should be a no-brainer. Since becoming chair of social services, I've also been meeting with advocates on how we can expand and expedite the building of supportive housing units statewide. I was pleased to see the governor's new 5-year plan to create and preserve 10,000 supportive housing units. The plan signals a welcome change in how our state approaches housing needs, and with a growing homelessness crisis, this investment could not come at a more appropriate time. Supportive housing is not only cheaper than housing individuals in shelters outright, it also reduces tenants' use of costly emergency care like inpatient psychiatric treatment and emergency rooms. Supportive housing has high retention rates and is proven to be effective in helping vulnerable families and individuals who are in need of additional services beyond housing placement, while reducing tenants' use of costly emergency care like inpatient and ERs. We've made strides in building additional units of supportive housing, but as we face such urgent needs, I'm continuing to push for an even larger investment. There is so much work to be done, and I know I've only scratched the surface, but again, I want to thank New Destiny Housing for all your work in protecting survivors of domestic violence through expanding access to affordable housing, which, as we know, is the most critical component to ensure their safety. Now you'll be hearing more about the benefits of supportive housing in the next panel, examining best practices to meet the needs of survivors and their families.
Yes. We'll clap in abstention. So this is our next panel, Supportive Housing. It will be moderated by Laura Mascuch, Executive Director, Supportive Housing Network of New York. Laura has nearly 30 years of experience in supportive housing and homelessness. She has spent the last 7 years as Executive Director of the Supportive Housing Network of New York, a membership organization representing more than 200 nonprofits across the state who provide over 55,000 units of supportive housing. The network helped lead a 3-year effort that eventually won commitments from the mayor and the governor to create 35,000 more units of supportive housing over the next 15 years. Our panelists today, Tiffany Jones is a domestic violence survivor and advocate. Tiffany has resided in a New Destiny housing building since the summer of 2020. Prior to that, she lived in a New York City domestic violence shelter where she moved to after leaving an abusive relationship in Texas. Becoming a tenant at New Destiny Housing helped relieve her fears during her transition into violence-free permanent housing. She currently works at Fordham University as a security guard and plans to pursue higher education. Tiffany, it's so good to have you here today.
Thank you.
Next is Issa Martinez-McDonald. She's one of ours at New Destiny. She's our regional director. She oversees all of our buildings in the Bronx and all of our amazing staff that are in these buildings. She has worked in this community for over 25 years, providing direct services and overseeing programs for homeless people, domestic violence survivors, individuals, mental illness and/or substance abuse, and AIDS, HIV. She joined New Destiny in November 2013 as the Housing Services Director. And prior to New Destiny, she was the director of Freedom House, a domestic violence shelter for people with disabilities. Kristie Thomas is with us today from Boston. She's an associate professor with an MSW director at Simmons University School of Social Work. She has extensive practice teaching and research expertise in the anti-violence field. Her work focuses on developing and enhancing community-informed programs for people affected by intimate partner violence, particularly those who are economically and socially marginalized. And finally, we have Toy Walker-Smith, manager of housing services at Willow Domestic Violence Center in Rochester, New York. Prior to being fast-tracked into a leadership position, she was a residential family counselor at Willow's 49-bed emergency shelter and has decades of case management experience in community settings. Toy oversees day-to-day services for survivors in Willow's supportive housing units and rapid rehousing programs, and manages a growing portfolio of new partnerships to expand supportive housing services for survivors in urban, suburban, and rural Monroe County. Thank you, everyone, for being here.
Okay, so we're close to the afternoon, so good afternoon, everyone. It's such a pleasure to be here today with this amazing panel. I really want to thank New Destiny, Nicole, and also Gabriella, who helped organize our panel, and Trinity for hosting us today. So great to be out. I know we've all been in our offices and in our homes, and it's just great to just be seeing somebody live and not in a box. So first, I think Assemblymember Rosenthal really introduced this panel, talking about really the strength of supportive housing as an option for families leaving homelessness, especially families who are recovering from domestic violence, reestablishing their lives and their communities. And really just to kind of set the table, supportive housing, as you know, was really invented early on to address the mental health crisis within homelessness and the substance abuse crisis within homelessness. And it was really geared towards single adults. But now, fast forward 30 years, the model is proving itself incredibly effective for a lot of populations, including victims of domestic violence, including youth leaving foster care, runaway and homeless youth, including veterans, families, seniors, individuals. So we really have expanded the model, and it's been amazing. So we're so happy about that. And then in addition, the state really recognized through the new Empire State Supportive Housing Initiative, or what we call ESHI, the need to really fund a variety of populations for supportive housing. And so it's really been, over these last couple of years, the impetus for doing more family domestic violence supportive housing, which has also been amazing. So with that said, we have a wonderful panel here today, and I'm so looking forward to the discussion of really talking to our presenters that have expertise in the academic area, being a tenant, and the service provider perspectives. And I just want to start off the conversation. I was hoping, Isa and Toy, you could describe for us your programs that you run and how they're geared toward domestic violence survivors.
Okay, Toy says that I should go first. Hi, good afternoon, everyone. Isa Martinez, and I am the Bronx Regional Director at New Destiny Housing. I run the Family Support Program, and we provide on-site services that are trauma-informed for all of our tenants that live in our buildings. You know, our model is unique because it really focuses on the issues affecting survivors of domestic violence and also people who have experienced, instability in housing. So our program, from the very beginning, it's all about really engaging with our tenants that are going to be moving into our buildings. Of course, some of you may have the opportunity on Friday to see some of our sites in Brooklyn, and maybe some in the Bronx, next week. I'm a little biased because I think that our buildings are gorgeous. So I see yes, thank you. So from the very beginning, we really engage with our tenants and our families before they even move into our buildings. If they're moving into a brand new building, it's really wonderful. We meet with them, we do a safety assessment. We really try not to be repetitious with the stories because we're very sensitive that survivors don't want to be repeating their stories. So from the get-go, we have that interaction. They also come and see the building and view the apartment that they will be moving in before they are there, and with their kids. So they really have that experience. And one of the things of being trauma-informed is that you really have to be transparent about the services that you're going to be providing that are available. And we see this as a collaboration, as a partnership with the tenants that come to live with us and the families. So from the very beginning, we described, even in the interview, we described the services that we have available should they choose to participate. Because as Chris was saying, everything is voluntary. Ages ago, we gave up, mandatory programs don't work anyways, right? So it's all about, meeting them, even before they moved in. Once they moved in, we have a series of events that we do to engage, tenants. And it's really about, I think that it was Cecile or maybe the panelists before that were describing that tenants are moving into areas where they don't know. So we really do tenant orientations are really important, and doing them at the time that is convenient for the tenants. So we will do tenants orientations in the mornings, in the evenings, some in Spanish, to really be, we put together a tenant handbook that is very specific for that neighborhood and for that building. And, basic information, how to pay your rent. We find out over the years that a lot of our tenants that come, live with us in our sites have never had their own apartment. So really it can be daunting. If you think back when you were younger and the first time that, that I moved out, I didn't know how to do those things either. So it's about building skills. So we will do tenant orientations. In our handbooks, they're going to find basic information. Where is the local drugstores? Where is the farmer's market? Where is the supermarkets? Where are the schools, the library? Very basic information. And we take it and we really build things over time. So from the beginning, before they move in, once they move in, and of course we provide case management services. Oftentimes, our tenants are moving in with a housing subsidy, and they don't realize that to maintain that subsidy is hard work. They have to understand, what subsidy do I have? Is it Section 8? Is it ESHI, as Laura mentioned? And really, what is the criteria to maintain that subsidy? So we really navigate all of those systems, something as simple as setting up your Con Ed, account. And all of that, so from the get-go, we're working with them on concrete services. We also, in the beginning, we really get to know the family because we really work with the family in a holistic way, not only with the head of household, but really the children. Other children are going to be changing, school, what is available to them, doing safety plannings, because oftentimes everybody thinks that you get housing and it's like you live happily ever after. Oftentimes it's the beginning of a lot of things, coming. So it's also normalizing that experience that when you were in shelter and your child was really well behaved and now you move to permanent housing and they're acting out, it's normal. When you were in shelter, you were going through a lot and so was your child. In a way, they may have perceived that it would be difficult for you to, be there when they're having their meltdowns or they're going through struggles. So it is normal that you have that, if your needs, because maybe you left things behind, you're starting afresh in a new building, you need things that you left, behind. Isolation is a very big part. So really building community, getting to know your neighbors, getting to know the people that are on your building. And once again, from the very beginning, we do this from day one until all the time that our tenants are with us, is that it's a partnership. We're there. We have really learned that every service that we provide is going to look different from one family to the next. So it's really working on their wellness plans. What are their goals for themselves, for their children? We have lots of, of workshops. We do a combination of therapeutic workshops, recreational workshops. I think I'm going over. And partners. I will just say for the last thing is that we could not do the work that we do if we didn't really have partners in our neighborhoods and, wonderful partners.
Well, that's really hard to follow up. I think Ms. Issa pretty much summed up everything. However, what makes our program slightly unique is that our permanent supportive housing program is located in our shelter building. So we have the option and the pleasure of having our survivors live with us long term. And we provide all the care that they need, all of it. Whatever that looks like, we provide it. We try to make sure that they're connected to everything that we still have in our shelter program. So we may have some of our survivors who are living in permanent supportive housing, which I like to say is a different level of survivorship, because once you move from shelter to permanent supportive housing, like you're on your way to stabilizing your life in some aspects. So they could call our hotline and say, hey, I'm out of toilet paper. We still provide those services to our permanent supportive housing tenants that are living with us in Hope Gardens. Thank you.
Thank you so much, Isa and Toy. So I'd love to hear next from Tiffany, just really your experience living in supportive housing and what impact that has had on your life. And so grateful that you're here with us today.
Thank you. It's an honor to be here. Thank you, New Destiny, for having me. I'm Tiffany Jones. I am from Houston, Texas. Hold on. I escaped a domestic situation, not knowing anything about New York. It was a chance I took. I knew nothing. Nothing about the shelter, nothing about, I just knew I wanted to get out of a situation that I had never seen any woman in my family do. They would stay. I didn't want to stay. My sons were grown enough. They were having kids of their own. They didn't need mommy no more. And they were getting on my nerves, so they were becoming part of the domestic violence, because it'd be times I want to shake and rattle them. So I knew I couldn't, and I didn't want them to hit on me. So I was like, what do I do for me? I moved to where I wanted to come as a little girl who don't want to be in New York. So, and it was at Miracle 34th Street started it all as a little girl who didn't want to come to Miracle on 34th Street, Macy's. So I called the hotline, and the guy said, hey, well, I said, is it a problem if I come from Texas? Would I be able to get some help? He said, sure. Do you need help getting here? I said, no, I just need a green light that I can come. He said, well, you have the green light. Just when you get here, call the hotline back and let us know that you are at the airport. Fine. I reached out to my job. I had been with my job since 2014. And I said, do you all have an office there that I can work out of? They said, yeah, you've been with us long enough. You know, it's Ally Universal, very good company, and they worldwide. So I was like, great, I'll be there. You know, I planned I even had my abuser help me move my stuff in storage. So I'm like, okay, this is what I'm gonna do. I told him I was coming here for school, which that's partial true, because New Destiny has helped me with that as well. I had no idea about no shelter, didn't know where to go, didn't know what to do. I left everything. Sorry. Starting over can be tough. And not only can it be tough from house to house, but from state to state. No bus. I didn't know nothing about a bus. Thank you. I know nothing about a bus. My family didn't know nothing about the abuse, because they also were abusive. People don't understand that domestic violence victims also go through that with family. It's not always just your mate. What makes it worse is it's your family, because they're like, you're not gonna leave, or that's your business. That's the worst statement to hear. I don't have nothing to do with that. That's your business. Okay, but I don't want to lose myself. I love myself. I love life. I love God. I trust God. I grew up in church. I sung for God. So I had to put all my trust into the plan that I made, which was to move in New York and start my life over. For me, I didn't have to worry about children. I didn't have to worry about a man. Material things I can get again, but I can't get my life again. I watched my mom go through it. She's deceased now. And I love myself enough to uproot myself and go somewhere and trust God entirely. And that's exactly what I did. Having did so, I went to the shelter after spending hours at the airport in LaGuardia. And the DV shelter, like I said, I knew nothing about it. So when the address had to be discreet. So they told me drop me off at a store. And I'm like, what? Where am I? What did I just put myself in? So I had to swallow that because I made this decision. I wasn't forced. I made this decision for me, and I have to keep going. And I went into the shelter, and they had to come. Actually, they had to send somebody to come and get me because I was totally lost, and I was just across the street. I had 3 large bags because I tried to take every bit of piece of clothing that I could, since I couldn't bring my pretty furniture, my pictures and all that. I tried to bring all the clothes that I could, not knowing that there was a weight limit even with that, bag limit even at the shelter. But God was still blessing me because them people let me bring all my stuff. And there was no elevator, so I had to drag up 3 big, huge bags taller than me up 6 flights of stairs at the shelter. The intake took about 8 hours because I didn't come from another, I forgot what system you go through before you go to the shelter, you get placed in the shelter here in New York. I can't think of the name right offhand, but they were so welcoming in the shelter to me. And they was like, you came all the way from Texas? I'm like, listen, if I could have went over to Paris, I would have went to Paris. But I've been wanting to come to New York all my life, so here I am. It's me in New York. And Tiffy takes on New York. So I get there, and blessingly, my job also gave me an account that happened to be at another shelter. So I was living in a shelter and working at another shelter. One was a family shelter, one was a domestic violence shelter. The beautiful thing about it, because I couldn't give the address out, it had to be discreet. Here's God again. My work was only 10 minutes in walking distance. And neither did my job nor the shelter I stayed knew this. And I told my case manager, I said, listen, I work like 10 minutes away. I walk to work. She was like, just don't let nobody follow you here because we don't want to get you, I was like, so do I get? She was like, no, just don't let nobody follow you here. Don't tell nobody the address. Oh, say less. Say less. So I didn't make friends. I didn't know nothing, though. I live in Brooklyn. I was telling people I live in Brooklyn when I only live 10 minutes away. My coworkers, I didn't trust anybody because I was scared to get put out in the shelter because I had nowhere to go. So I wanted to follow every rule down to the pinpoint because I made a decision. So God was constantly working. So here I am in the shelter. I'm working. The pandemic kicked in. I beg his pardon because I can't even tour the place now. So it's like I got to stay put. I got to wear a mask all the time. It's a whole new ball game because of the pandemic, and I had to enforce rules and follow rules of the same kind because they were all shelters. That was a stressful point, and actually that's beating to the punch of challenging because that was challenging of having to enforce the same rules that I had to follow. And it was crazy. So living in a shelter, my case manager, my housing specialist, they were all trying to help me get things together. I thought that they were going to put me out because I didn't have a police report on my abuser. I didn't have a police report because he, like manipulating abusers are, I'll call the police on you. Okay, so you know what? You ain't got to call the police on me. I ain't going to jail. I'm not going to lose my security license when all I can do is make a decision to just get away from you. So that landed me again. That landed me here in New York. Then the struggle came with all of these pamphlets from the housing specialist. You got to fill out this application. And it's like, oh, I don't make this much money. Like, what am I do? Like they're gonna put. I was always feared that they're gonna put me out because I wasn't. I didn't make enough money. I didn't have. I'm basically a baby in New York. Like, what do I do now? What do I do? I felt so codependent on the shelter to help me with, but they did a good job because my housing specialist, Miss Ortiz, bless her heart, she came and told me one day, she said, Tiffany, I got something for you. I said, what? She said, it's this organization called New Destiny. I was like, that's my granddaughter's name. I said, maybe it's meant for me. She was like, go check it out. Fill out this application, go check it out. And the first place was on somewhere by Fordham. It was and I actually went over there on my lunch when I got off of work one day to just look at the area, and I was scared. I was like, I gotta live over here. Like, people were stopping and talking, drinking, and it was a lot of stuff going on. And I was like, oh, well, you know what, Tiffany? Swallow your pride. So I stayed talking to myself, swallow your pride. Then I get back and they say, 2 days later, Miss Ortiz said, they said you can't move there. So I was like, why? They was like, we got something better for you. I was like, get out of here, New Destiny. I was like, please send me over there. So they sent me to Anderson. I looked at the apartment. The maintenance guy, he was really nice. He showed me around. The building was nice and clean. The street was clean. Once I moved in, I met Miss Ty and I met Miss Berry. Oh my God, I'm telling you, it's like family. Anything that they're comforting, from the voice tone to the understanding to the not walking away after they say something, stand there. Like, if I had any more questions, is there anything we can do to help? Any more we can do? They were always available. And it's just, I got a long story, you guys. Like I can really go so far along how New Destiny has blessed my life. God literally, like I said, my granddaughter, it was destined for me to be around a Destiny. I'm here now, and I'm appreciative. They have provided rental assistance for me. They have provided food, because I can't afford a lot of stuff. Like, the transition has been so hard to even think about. But as Ty would make an appointment with me, it should always let me get it out. She always said, what can we help you with? What do you want? What do you want? She always laid the table out for me. What is it that we can do for you? She'll take notes. She'll follow up. I've never had that before. And when I go up to my place, it's like I'm home. I'm comfortable. I'm safe. So I no longer felt like I was a victim of my circumstances no more. I felt like I was a victor. New Destiny, my building, you got to get through 2 doors. No piggybacking. That was so safe. I hurry up and slam door behind me. God. Because I don't want nobody to come in behind me. I don't open my door, because when somebody ring the doorbell, I don't buzz people up. And I kind of feel bad, because what if I lose my keys sometime? But then at the same time, you got to think about everybody's safety. This is what I do for a living. I'm a safety person. I do security. So I have to implement that in my own life with keeping everybody in the building secure. Everything has been helpful. When I don't have food, I can reach out to New Destiny. I can reach out to them via email, text message, holler downstairs. No, I'm just kidding. But the services has been helpful. The holidays has been hurtful, because living in this big city where you have no family can be really lonely. But for some reason, this building make me feel like I'm not lonely anymore. You know, it's like even my neighbors, they've all been very kind and helpful. Now my family want to visit me, and I don't want them to. I'm being stingy with New York right now because I feel like New York is mine. Y'all's too, but you know, it's like everything has been going great for me, and I've been blessed tremendously. I came with nothing. My apartment got completely furnished by an organization by this lady named Shoshana. Oh my gosh, she was an angel, God's angel. Like literally everything that I left, God replaced and more. I am a true testimony to believe in God. He will put the right people in your life. And yes, this organization can use help. If I can go through this, anybody can. I don't want nobody to feel like they're stuck in a situation, because I can sit with them and let them know you're never stuck. You're never stuck. You can move around. Look at me. I moved over 1,200 miles away without nowhere to go, didn't know anybody, no friends, no nothing. Just colleagues through my company. And honestly, and God. And that's all I needed to start over. And I wouldn't trade it for the world. I really appreciate New Destiny. You guys have been... I wouldn't detach myself from y'all no time soon. If I get rich, I'll just donate more money to you guys because, listen, this has been one blessing after another from the moment I landed in LaGuardia. From the moment I made that first phone call, all it takes is a phone call. The young lady said earlier to share your story. Since I've been in New York, everybody I talked to, what brought you to New York? What brought you to New York? And I end up sharing my story, not for a pity party, but because it feels comfortable to talk about it. And it feels good to get it off my chest. And I've had so many women say, wow, you're brave. Wow, you're strong. But deep down inside, I'm breaking. I'm hurt.
Tiffany, thank you so much. Thank you so much for just sharing your stories so honestly and grounding us today really in the work. And I love Victor, not victim. Love it. Just amazing. And just really so grateful to have you here today.
I'm grateful. Thank you.
Thank you. So earlier in our panels, we heard a lot about the importance of data and showing that models work, but we also heard about the F word. I love that, meaning flexibility. And so we're very fortunate today to have Kristie here with us, who worked with New Destiny to really evaluate the family support program and really trying to prove it as an effective model. So Kristie, we'd love to hear about your findings.
Sure. Thank you, everyone. I have had the privilege of working with New Destiny for over 2 years, and it really has been a privilege. It's just been a wonderful team to work with. The evaluation that we did was truly collaborative. Issa, Brenda, Carol, when she was still here, played a huge role. Dan came on into this project. And so just to say that the staff were involved from sort of soup to nuts in this project, it was a pretty, I would say, pretty large undertaking. So we collected data from both staff and tenants. We did surveys and also in-depth interviews with all of the staff, and then 20 in-depth interviews, and we got survey responses from about 50 of the tenants. And overwhelmingly, the results were overwhelmingly positive and actually mimicked so much of what you've shared already, Tiffany, in terms of people having very positive experiences with New Destiny, and really sort of underscoring the importance of supportive services, that it's not just housing, it's housing plus services. So in terms of, we looked both at process and outcome. So in terms of the process, the sort of experience of the program, just looking at my notes here, my little cheat sheet. One of the most helpful features of the New Destiny Family Support Program is that the services are on site. What that allows for is the tenants have very busy lives. They're juggling so many really important aspects, basic needs, multiple jobs, children. I mean, you all know this. And so having them on site really reduced a lot of the traditional barriers to help seeking. So being able to just like pop into the office and talk to someone or get something photocopied, use the computer, or to, Tiffany, as you talked about, just to talk a little bit about how the day went and, some of the maybe challenges of the day. So having it on site is hugely beneficial. And we actually asked tenants if they would prefer to live in a building without services, and overwhelmingly they said no, that they really did want the services. They wanted to be in a building with services on site. And then the voluntary piece, so we've talked about this, obviously, mandated services are not an option, but the feeling of them being very voluntary was something that was very helpful because it really allows for restoring choice and control, which obviously is so important for people who've experienced domestic violence, that, the tenants who participated in the evaluation talked about it, like even if they didn't use the services all the time, just knowing that they were there and knowing that it was an open door was something that was very helpful. Also, the added security measures were very important. So the cameras, the front door monitor, that feeling of extra security was really helpful. And then we used the trauma-informed practice scales to assess the level to which the agency had effectively adopted a trauma-informed practice approach, and the results were amazing. It's very clear that the program has really just done an excellent job with being trauma-informed. And then in terms of the outcomes, this was all perceived impact just because the way that the design of the intervention, or the design of the evaluation, like we couldn't like show cause and effect, but overwhelmingly staff and tenants talked about how the supportive service program really helped to increase their housing instability. That's not what I meant to say at all. Increase their housing stability, and that it would have been hard for many tenants to maintain stability without that extra layer of support, particularly around budgeting, workshops, referrals, helping with the recertification for vouchers, those sorts of things. And that the combination of the housing and the supportive services allowed them to achieve other goals. So you can think about it in terms of, when you have all of these juggling, competing demands, if you're able to sort of satisfy some of those, right? Like you're now safe, you're now in housing. Now you can think about your education, your children's education. You can think about that. It's like that sort of you take a couple deep breaths and then focus on other things. So 40% of tenants said their education had increased since moving into the unit. I heard wonderful stories about advanced degrees, getting landing the job of their dreams. And then the other thing that I really want to highlight is the children's services. So I've been working in the domestic violence field for a while and working with lots of organizations. And I think that one of the things that I've seen is that DV organizations don't always serve children as well as they could or as holistically as they could. I think children often get the short shrift, honestly. There's lots of reasons for that, which, I could talk about it if you want to take a class with me or something. We can talk about it another time. But New Destiny does amazing work with kids. The work that they do is really just this robust menu of services, and what the tenants talked about was really how they saw changes in their children's social, emotional, and cognitive development. And the provision of those services also provided a very helpful mental health break for the parents, right? Like to just get a couple hours to yourself while your kids are safe downstairs doing lots of fun things. So basically it was there are some, you can read the report, there's other pieces to it, but I think those are sort of the major highlights and takeaways. It was a fun project to work on, so.
Thank you so much, Kristie. I think you aptly described what we call the secret sauce of supportive housing. That services are available, but they're voluntary, that it's a housing first model, and that it's really, really driven by what the tenant wants, right? It's not dictated. It's where do you want to take your life? And that, I think, makes it incredibly, incredibly successful. So, Toy, I just wanted to go back to you. How should we define success in supportive housing? What metrics should we use? I think sometimes we get stuck in the fact that you're still housed. Well, that's great. It's permanent housing. We hope you're still housed. But what else should we be looking at?
Well, honestly, defining success is by the survivor, period. Like, we don't get to say, well, now you're successful because you've done this. What works for one survivor may not work for another one. So it's really just how they defined success. If success is just getting up in the morning and brewing a cup of coffee, then that's their success for the day. If their success is, hey, I'm going to apply for 5 to 6 jobs, then that's their success. I don't get to tell them what's successful and what isn't.
That's a great answer and follows along with really the tenant being the driver of services. Thank you. Kristie, what did you think your study found for which services were the most important ones to be used, or the ones that were most accessed by the parents and the children?
I mean, I would say the children's services are definitely the ones that get used the most. I mean, I think because parents are busy and some other factors, they really, it seemed like the children's engagement was definitely the highest. In terms of, I'm trying to think through the specific services. I definitely heard a lot of just being able to go downstairs and talk and being able to get some tangible help with things, like I said, like photocopying, using the computer, those sorts of things. And then also participation in some of the group activities was really helpful in terms of budgeting, and there's also a focus on physical and mental health, so yoga and other activities. So I think those are some of the things that were most helpful.
Great. I also wanted to, Isa, I know you talked a lot about building community in the buildings and, a work to kind of, get people who have obviously left very traumatic situations and trying to build that community in supportive housing. So what do you think the best ways are that we can do that?
Just in general, in supportive housing?
Yes.
Yeah. I actually, one of the things that we've done is also working with our staff, because training and support for the staff is really key. So, we were fortunate enough to get a grant, so we were able to work with a consultant before, Kristie came to evaluate us, and really looking at the way that we were delivering service, which is a partnership with our tenants. If we were really in terms of trauma informed. And one of the things that we really learned that we were doing, but we could have always, improved, was really also taking care of ourselves, really making sure that the staff has the tools that they need, training, debriefing when situations, occur. Being there for each other. You would think that we're supportive housing and we really have an array, and lots of staff. But in our sites, where Tiffany is, we have Barry, who's our tenant support coordinator, who's here today, and Taisha, who's our case manager and does a lot of activities with, with kids and with families. And so our staff is not really large. Somebody said this morning, we're small, but we're mighty. And it's really getting the community involved. When we do events for Mother's Days, for Thanksgiving, our tenants are really an extension. They come and they help us. We do potlucks. It's really building. So I would say that it's really understanding the community that you're working with, really listening, and also to train your staff and support your staff. Because life happens to all of us. And I think that that's really key. We're, at New Destiny, we're really blessed that I think that we have the best staff. They're very committed. They're very, compassionate. So I think that that's really key, because, we don't go to this, for this work for the money. So we really need to have, and have that understanding.
Absolutely. I know we just have a few minutes before we open it up for questions, but we now have a new mayor and a new governor who are working together, who are saying a lot of the right things. And I'm going to throw this out to the panel. What would you suggest that they do differently or do more of? Toy, do you want to start?
I do.
Yeah.
The young lady that shared her story with us earlier, and I think Miss Tiffany touched on it also, is that when women come into domestic violence shelters, they're leaving everything twice. They're leaving everything that they knew, and then when they leave the shelter, they're also leaving with nothing because they just leave with their paperwork and so on and so forth. I would like for our governor, Mrs. Hochul, to really invest money into giving our survivors the basic things that they need for apartments, such as furnishing apartments, such as, those are basic needs. We need beds, they need chairs, they need tables. I would like more funding to go towards giving our survivors the things that they need to be successful in their apartments and to continue going on. There's a whole bunch of other things, but I'll let someone else speak.
I would piggyback on that because, as I was saying, you get housing and now you're settled and you do get, let's say you get the furniture, is that we really need the flexible funding because it's going to be different for every family. Someone may need more, funding because they need to buy special adaptive equipment for their kids. They need to buy, other school supplies that they were not able to get. A mom is going back to school and, needs monies to be able to buy the books that, that they need. So I think that, because everything, when our tenants come to us and they come to us with different needs, we start putting our heads together. Okay, so we know this organization does A, this organization does this, but if we have the flexibility, if we're really listening to, to our tenants and our survivors and listening to what is it that they need, if we had if we were fortunate enough to have that flexible funding.
Wonderful.
Also, piggybacking back.
Yeah.
Are just piggybacking off of each other. It's also like making the policies flexible enough to meet our survivors where they are. That's pretty much what we're saying is give us the flexibility to do what we need to do to help our survivors.
I think there's always this tension, right, of meeting the funders or the government funders, the foundations, meeting their expectations and showing the worth of the program. But this, if people are great providers, which we have great providers, they should have the flexibility. They've kind of earned it. They know, and their tenants know what they need, and it's just hard to kind of push that into policy because there's always the one or two bad actors, and then the whole, everyone gets painted by the same brush. But I, absolutely agree. So I think we're going to, go ahead. No, Kristie, go ahead.
I don't know New York, so maybe this is a thing, but as everyone has already said, just universal childcare. I mean, I think that my hope is that the pandemic, one of the, tiny silver linings is that people who may not have had to worry about childcare have now experienced what it's like to not have childcare when your children aren't at school and juggling, right? So I feel like now is the time to seize upon that and to say, we cannot expect people to work if they don't have childcare. And so if there's any way to continue the payments, the subsidies, or just make school free for children, for babies, that would be great.
Absolutely. So should we open it up? Yeah, I'm getting nods. Yes. Okay. Anyone in the audience have a question?
I'm full of questions today.
Yeah.
Issa, you mentioned the training for staff. Can you get a little bit more specific on the actual training and maybe the modules that were used? And you also mentioned the tenant orientation. Can you get a little bit specific on what that entailed as well?
Sure. So on the staff training, of course, it's also going to be, once again, depending on the knowledge of the staff. So one of the trainings that for sure we need to have is motivational interviewing. And I would really, if you really wanted institute trauma-informed services, motivational interviewing is really important. Also, understanding what is trauma-informed and delivering your services through those lenses. So we were fortunately that when we were working with our consultant, we did a lot of trainings and we did a lot of webinars, and we actually have a lot of that information. We work with organizations that do more trainings on that. in terms of, of the trauma informed. We also work with kids who have, special needs. So we partner with organizations, for example, CUSAC, who really work with kids on the spectrum. Not only have they trained the staff, they also provide, services for our kids and for the parents. And the other one is the tenant orientation. As I was saying, a lot of our tenants are moving into neighborhoods that they don't know. So doing the tenant orientation is really important. And we have tenant handbooks that we are always updating that has current information on everything. And it's really also an opportunity for the tenants to meet other tenants, and you start building community.
Patricia.
Hi, guys. So thank you so much, and thank you, Tiffany, for sharing your story. So my quick question is, we know that there's an intersection between family homelessness, domestic violence, and child welfare. Can you talk a little bit about what opportunities are there for supportive housing to work within the child welfare system, if you thought about that, given that possibly some of your clients might have children involved in child welfare?
Who wants to take that one?
Great question. I'm seeing Tiffany and Toy, both of you leaning in. Maybe one can start.
One thing that I would definitely like to see is more preventative worker services offered to our survivors. And yeah, having more preventative services so that it doesn't get to where child protective services are involved. Giving the children the space, giving the children the services that they need, such as mental health care, such as getting them to primary care physicians and things like that. So I think we need more preventative workers to work with the case managers working in the shelters to help give the children the care that they need.
Yeah, I would say that the same for us. One of the things that Kristie found out when she was doing the evaluation of our program is that our children's services really enrich, and that is that we work with the family as a whole. So we know, most of our families are headed by head of household single. And so we also know that if a mom has to leave, work to go and go to the school because something happens, that they need that support. So it really is giving, the support to the whole family. So while mom may be in a parenting group, we don't call it a parenting group. We call it a conversation cafe, where all the parents come and get together and they discuss, mutual situations that they may have with their kids. We have a really rich services for our children, where it's a combination of therapeutic activities and also recreational activities. And we really have great partners. One of the partners that we have been working probably for almost 6 years has been the Art Therapy Project. And it's a wonderful not-for-profit organization, and they specialize in working with youth who are at risk and who've experienced trauma. And they're licensed as therapists, and they come to the site and they do therapeutic activities, with our kids. We even had an opportunity that they showcase, they did a whole show around some of our kids' arts, which was really awesome a few years back. I think that, when you're working with the whole family, when things come up. We have very few situations where really the Office of Children and Services, are involved. And once, that does happen, it's really about, prevention. It's also about coordinating services and giving the family and the child the support that they need and what is it that they would like to see. But prevention is really key.
And Tiffany, I'm going to give you the last word. We have 2 minutes. I'm getting my 2-minute signal. But anything else you'd like to share with us today? Or any policy recommendations for our government leaders?
Well, look, be more, because as when I went into the shelter, it was a little difficult for me to understand that because I didn't have children with me, and it was just, I was a single woman, like I needed just as much help as mothers with children. because my situation, I mean, my boys, they went through it as well. And actually, I wish I had knew about all of this when they were younger, when I went through it with them, because I knew I had no services when they were going through it. So maybe if they kind of soften the blow with with single women, because like even when I was in the shelter, I didn't think that I would get out as fast as I did with women that were still there with children. Like, you know, I felt like I cheated them, but that wasn't, like, that's not my business. Like, this is my blessing. I have to worry about myself at this time. But I felt like, wow, like, I don't have any kids with me, and my process is moving fast. And it's not like it's a favoritism thing, because no one knew me, and I didn't know them. I just did what was required for me to do what I needed to do. But maybe if they develop a little bit more softer blow for single women who are victims of circumstances, to show them that, hey, you're just as important as mothers with children, you know?
That's a great point. Again, thank you so much to everyone for joining us today. An amazing panel. Thank you to New Destiny and to Trinity.